Dr. Briana Woods-Jaeger is an assistant professor in the Department of Behavioral, Social, and Health Education Sciences at Emory University and a licensed clinical psychologist specializing in traumatic stress and culturally responsive interventions. Dr. Woods-Jaeger research examines social and structural factors that link the experience of child trauma and adversity to mental and physical health disparities. Her work focuses on partnering with communities to identify ways to prevent adverse childhood experiences and support different systems such as education, healthcare, and community-based organizations in responding to the needs of trauma-exposed youth and families. She is currently a principal investigator on research projects supported by the National Institutes of Health and Centers for Disease Control and Prevention, focused on primary and secondary violence prevention and promoting resilience after experiencing trauma and adversity. Our next speaker is Abigail Lott, PhD. She is an assistant professor in the Department of Psychiatry and Behavioral Sciences at Emory University. She serves as co-director of the Grady Trauma Project and psych director of the Grady Trauma Recovery Center. Dr. Lott received her PhD in clinical psychology from Washington University in St. Louis and completed her postdoctoral fellowship at Emory University School of Medicine. Dr. Lott's research focuses broadly on identifying psychological and biological mechanisms of risk related to the impact of interpersonal trauma exposure on adverse health outcomes and improving trauma-related treatment access and outcomes in underserved urban communities. Welcome, Briana and Abigail.
Oh, Abby, you're muted.
Thanks, just noticed. Good morning, everyone.
Good morning, everyone. Great to be here. So thank you, PSI, for having us. We're really excited to be here today to be part of this really important event and conversation. Again, I'm Dr. Woods-Jaeger, and I'm excited to be here with my colleague, Dr. Lott, to share some of the work that we've been doing around promoting Black maternal mental health. And I believe I'll turn it over to Abby to start us off.
Yeah, absolutely. We can go ahead and start the slides. So I think first we're just noting quickly our funding and disclosures. For myself, you can see here what I'm supported by. I don't have any disclosures, but in terms of my positionality, I self-identify as a white woman and here as an ally with also having 2 young children.
And then for me, just that I self-identify as a Black woman with 2 young children as well.
So I want to highlight today some of the things we're going to be focusing on. I'm going to start out by giving kind of a broad view of defining what we mean when we're talking about traumatic stress, as well as discussing the intergenerational effects of traumatic stress. And then we'll be moving into Dr. Woods-Jaeger talking about some specific strategies and interventions that are helpful and really getting into the work that she's done in the community with Black women to identify strategies that can be helpful for combating traumatic stress across generations. Next slide, please. So, I think it's important just to put forth what I'm talking about when I'm talking about trauma. There are lots of ways in which we can think about trauma, and it's very broad. So I'm going to go through these definitions really quickly, so it kind of grounds what I'll be talking about moving forward. So I'm taking SAMHSA's definition of trauma here to just describe that trauma results from an event or series of events in which an individual experiences physical or emotional harm or a life-threatening experience that has long-lasting consequences on the individual's functioning across various areas: mental, physical, social, emotional, or spiritual well-being. And an individual's experience of trauma is very personal. How it presents itself, what happens as a result of that trauma and its consequences really varies by person to person and can be impacted by other contexts, as we'll talk more about, and kind of Kimberly has spent so much time highlighting in terms of the impacts of racism in particular. Adverse childhood experiences, or ACEs, are stressful or traumatic experiences that occur during childhood. And those can include things like physical and sexual abuse, emotional abuse, as well as emotional and physical neglect, and also aspects of household dysfunction, things like witnessing interpersonal violence between caregivers, mental illness or drug use in caregivers, as well as caregiver incarceration. Oh, sorry, I thought it was going to the next slide. Stay on this slide for one more minute. Toxic stress is another definition that I want to highlight. And toxic stress is the stress response that can occur for a person who's experiencing strong, frequent, or prolonged adversity. And examples of that include poverty, discrimination, systemic racism, historical trauma, or violence in the community. And without adequate support, can have strong and lasting impacts on body and mind. Go to the next slide. And has already been talked about so much today in really impactful ways. We know that in addition to the experience of chronic trauma exposure, so repeated traumas over one's life, that there's an interacting effect of race, racial stress, systemic racism, chronic trauma exposure, as well as other stressors like socioeconomic resource limitations, and that those are experienced at particularly high levels in communities of color, including Black women. And similar to trauma, we see the effects of chronic exposure to racism impact emotions, impact the body's stress response, impact physiological, kind of how the body continues to grow and develop. And although we've already been talking some about, or some of the prior speakers have spoken to the vast detrimental impact of postpartum depression, one of the common reactions that we see in the context of traumatic stress is post-traumatic stress disorder, or PTSD. And rates of PTSD and depression are as high as 50% in communities of color with low socioeconomic resources. So PTSD is really impactful and something that we need to be paying attention to and considering. Go ahead and go to the next slide. When we think about some of the traumatic stress effects in pregnancy for Black women, what has already been talked about prior, we know that there are high race disparities in terms of those that are more likely, Black women are substantially more likely to die of pregnancy-related complications. In addition, we know that interpersonal related traumas, things like sexual assault, intimate partner violence, are highly prevalent, but PTSD is really underscreened and undertreated in obstetrics settings. So, while I think folks are tending to get better about identifying and screening for depression and to some extent anxiety, we see really high rates of PTSD, and yet these are underscreened and undertreated. Also, as all of you as mothers know, pregnancy really wreaks havoc on the body, and those changes can be re-traumatizing in and of themselves, in addition to the trauma that can occur with the birth experience. When we think about, it's not only the difficult experiences that can occur during labor, during birth, but past experiences that individuals have had, adverse childhood experiences, can get reactivated and symptoms be intensified in the context of pregnancy because of the different challenges that are navigated. Next slide, please. And as I mentioned, it's important to think about the intergenerational effects of traumatic stress. So we know from research that pregnant women with both PTSD or depression have a 4-fold increased risk of adverse child health outcomes, including preterm birth, lower birth rate, and gestational age. And so identifying post-traumatic stress disorder and depression in pregnancy is really critical to help us improve those health outcomes for both moms and babies. Maternal PTSD and depression in the postpartum period are also really impactful on child health outcomes over development. And parenting related stress and negative parenting behaviors are one pathway that can occur. And so it's really important for treating PTSD and depression and other psychological effects of traumatic stress as early as possible in order to help reduce those adverse intergenerational effects. We also know that children who experience ACEs, there's a cumulative burden on increasing risk for many poor health outcomes, including effects on brain development, immune and stress functioning, hormonal systems, and even DNA transcription. Individual children who have a cumulative burden of ACEs also have less, are less likely to live as long and have, that prolonged activation of one's stress response system really occurs in the absence of protective relationships. And so we know that enhancing those protective relationships within the family or within broader family systems is really helpful in reducing those health disparities and burdens that we see. There's also a disproportionate burden of ACEs for children living in communities of color. And so this is particularly important for us to keep in mind in thinking about reducing risk. And finally, in thinking about the impact of ACEs, we know that ACEs is really an important contributor to both socioeconomic and racial health disparities that are seen and cannot be ignored when we're thinking about how we continue to improve racial equity and health equity. So I'm going to talk just for a second on, I'm going to be aware of time, about research program that I co-direct, the Grady Trauma Project. And we'll present just a little bit of data from our work to highlight the rates of PTSD and depression in pregnant women in particular that are served at Grady. So GTP has been around for over 15 years, and this is the largest study of civilian trauma and PTSD in the world. Our focus has really been on taking a broader epidemiologically based approach to understanding risk and resilience factors related to trauma exposure in downtown Atlanta in patients that are served at Grady Health System. And so we've interviewed more than 12,000 individuals about trauma and its effects within individuals seeking services for medical conditions at Grady. And so in the waiting rooms, having conversations about their experiences with trauma. And through that, have really worked to develop knowledge about how we can improve care and really begin to reduce that intergenerational risk related to traumatic stress that we see. And so a big focus has been on providing trauma-informed and culturally responsive interventions that are helping address the many vast adverse effects of traumatic stress. We'll go to the next slide. So work by myself and Briana. More recently, we interviewed more than 600 individuals that were Black women that were seeking services at Grady obstetrics clinics. And what we found was that roughly 30% of the women had a probable diagnosis of PTSD, and similarly around 30% for depression during their pregnancy. But what you note from the graphs is that we see very low rates of treatment for post-traumatic stress disorder. And in fact, of a smaller sample, which we had chart abstraction data, so looked at the individual's medical charts, we found that of those 358 women that we looked at, none had discussed a PTSD diagnosis or talked about that in the context of their OB visit. Just highlighting how, although we know that traumatic stress and the intersection of trauma and racism is really increases Black women's risk for the development of PTSD symptoms. It's something that's sort of not being paid attention to, not being really overlooked by healthcare providers, and we're kind of needing to address that in the context of how we can continue to better serve patients. Okay, I'm going to transition over to Briana.
Thanks, Abby. So just to kind of continue along those lines of really thinking about what are some of the barriers to addressing PTSD and depression among Black pregnant women. And as you can see, there's numerous ones. And so, we have limited culturally responsive treatments that are available. They're often not trauma informed and integrated into these settings. So there's really an access issue. And so part of what we're thinking about is how can we improve access? How can we improve the quality of care that's provided to really address these stark disparities? And there's many things to consider. So as you can see here, 12, the average being 12 different barriers to getting the mental health supports needed among Black pregnant women is alarming. I mean, that is very high, and you can see a range. So a lot of times we think about things like transportation and cost, but there's a lot of other things that we need to think about in terms of what is happening in the daily lives of these women. So having multiple other responsibilities, having work environments that don't allow them to take off time to take care of their physical or mental health, experiencing other physical health issues, and then some concerns that are really important for us to better understand around this concern about talking about problems can make them worse. Being worried about being seen as too emotional. And as we've heard earlier, there's a lot of stereotypes, right, that Black women have to contend with that makes a lot of sense why they wouldn't want to be perceived in this way, or might feel there could be harm if they are perceived in this way. And then some difficulties that really are related to mental health symptoms, like having a lack of energy or motivation. All of these things are really important for us to be considering as we think about how we can provide multiple pathways to promote mental health. Next slide, please. So a lot of the work that we're trying to do is think about, again, how can we improve the care that's provided within healthcare systems? And then also a lot of work that I do in the community is really thinking about how can we learn from the community. I really appreciate the conversation earlier. The community does have solutions. And so how can we learn from them around different ways we can promote resilience? We do know from research that there are some tools out there that are available, and really thinking about how can we make these more accessible. So mindfulness is a strategy that has been found to be culturally relevant in terms of being an intervention that can reduce stress-related health disparities among African Americans. And it's found to be feasible and acceptable among African American women, so that this is something that's relevant and it's something that we can be really thinking about applying in a broader way. It's also cost effective and scalable, meaning that we can do this in a lot of different settings. So a lot of my work is in community-based organizations, early childcare centers, and these are opportunities to really infuse some of these approaches in the places where Black pregnant women are interacting daily. Another really important thing for us to look at is what's already happening. So what are Black pregnant women doing to really promote resilience? And emotion regulation is a big source of resilience for Black women during pregnancy. However, there's also different factors that they have to contend with in terms of thinking about emotion regulation, such as this idea of being a strong Black woman, which comes with a lot of connotations. I mean, there's good and bad, and we'll hear some of that in the data that we found in terms of a lot of the strength and resilience can come from that, constantly being able to provide for others, being independent. But there's also these challenges of having to suppress your own emotions, right? Having to push down to push through. Not being able to seek emotional support from others because you're the emotional support. So there's both, again, like the pros and cons, if you want to think of it that way. And we really want to understand this better, particularly during pregnancy. Next slide, please. So we're doing this project now called Moms to Be Thrive. And again, really trying to learn from the community what we can be doing better in the healthcare system, but also what we can be doing in the community and what's already happening that we can uplift. And so right now we're doing focus groups with Black pregnant women to really understand their experiences of mental health and toxic stress. What do they recommend in terms of supports and resources? And what are barriers that we need to really be paying attention to, as well as facilitators? What are things that can really help in terms of providing more support and resources? Our goal is to reach 40 African-American women with these in these focus groups. So far, we have had 7, but I wanted to highlight some of what has been shared because I think it's so important to learn from the lived experience of those who are really navigating these issues day in and day out. I'm going to quickly go through this because we don't have a lot of time and I want to get to you actually hearing from them. So I'm going to go to the next slide just to share some of the preliminary themes that we've been hearing from these focus groups in terms of strategies that we should be considering. So the first one is that pregnancy is an emotionally vulnerable period in a woman's life. And I think we understand this, but there's a lot of different ways to think about how do we address it. So this first quote, the thing about being pregnant, your emotions take a big toll on you mentally and physically. And so really just recognizing the toll that can be taken during pregnancy and how do we provide supports. The second quote really speaks to some of that, what we were talking about around the environment that we're in and how that can really relate to how we handle our emotions. So that kind of hurts your emotions when people want to throw their judgment around, or sometimes you have to protect your privacy or your peace by not saying anything, but then you end up bottling up emotions. So again, this idea of having to stuff it down or suppress because we don't have safe places to express, be heard, and be affirmed around our emotional experience. We've also heard, again, a lot about this strong Black woman, we call it schema or idea or norm, and that there's both the strength and the resilience that comes from that, but also the cost in terms of it being a burden. So this first participant shared, I feel like when you hear a strong Black woman, I hear backbone. It's kind of like a blessing and a curse at the same time because they expect us to be almighty all the time and not soft or treated like, you know, at the end of the day, we are women. So it would be nice to be treated with a little bit of softness. And this is something that I've heard a lot in my previous work too, in terms of really being seen as you have to be the one caring for others. You have to be the one that always shows up strong and resilient. And of course, as we've heard about all the racism that has to be navigated on multiple levels, that is something that we've had to adapt and do. But because of that, there's often not who's taking care of you, right? Who's nurturing you? Or do you even get the space for yourself, right? To be able to do that. So we're definitely hearing that. And then the second one, talking about it being 24/7, right? So they see a Black woman, they expect you to be strong. They expect you to wear all these different hats. They expect you to take care of the children 24/7 and go to work 24/7. And then they expect you to do it all. So again, these heavy expectations, particularly when you think about pregnancy and the vulnerabilities that can happen during that time. And then finally, you know, again, really wanting to find different ways that we can think about promoting mental health. We've heard a lot about social media being a key resource. And I think this is definitely, women talked about already accessing this as a resource during pregnancy, and this to be a place where we can really spread some of this, these resources more broadly. And so this last quote just reflects on that. And one of the things I want to highlight here, in terms of social media or ads or word of mouth, is really thinking about, a lot of times we're promoting sort of some of the deficit narratives through that. So you hear the bad stuff, as this person says, we hear so much of the bad stuff when it comes to advertisement, and you never hear the good. So being that this is something good, I would definitely word of mouth, spread it word of mouth as well. So how do we start to spread the strengths and the assets and the resources as opposed to just the negative messages? Next slide, please. So based on this, and we're continuing to do these focus groups. So this is an ongoing process where we are really learning from those with lived experience and using that to inform our approach. We are developing a social media campaign that includes videos, psychoeducation materials to really be able to, again, provide resources more broadly. And two of the areas that we're focused on based on what we've heard so far is mindfulness of emotions. So really providing some resources and tools to help women during that really emotional, vulnerable time be able to experience rather than suppress their emotions. But again, you have to really think about that needs to be done in a place that is a safe, affirming, and validating space. Because often, unfortunately, they will be punished for their emotions. So we're really being thoughtful about that. So providing exercises that you can do, like this waves of emotion mindfulness practice. We have an emotion wheel where we've actually, research shows that naming your feelings and be able to do that in the moment can actually regulate them in and of itself. But also really sharing testimonials of what Black pregnant women are already doing. So wanting to really highlight and uplift the strengths and be able to share that more broadly and have a network where people are sharing their resources, sharing what they're doing. So this first quote, I wrote a lot when I didn't understand all the different emotions that I was having in the moment. I just started writing every single last one of the feelings down, everything I was thinking at the time. So really promoting being able to express through writing, other creative outlets, but being able to really get it all out, right? So we're not holding it all in or stuffing it down. Another participant shared with us, with my emotions, I just let it, I cry it out. And then I take a long walk just to breathe, and then it calms down and I get back to myself. And this is really powerful because we've heard a lot, like, again, back to that barrier of not wanting to talk about emotions because really it can be overwhelming or feel like that it'll just like open up something that you've been, keeping down for so long and you won't be able to handle it or manage it. Having more testimonials about how people are managing it and how they, as she said, gets back to herself when she does experience these really intense emotions is important. And then the Pleasant Events Diary is another tool, but really talking about how to increase the experience of pleasant emotions by mindfully engaging in pleasant events. And of course, this requires there to be time and resources to do that, which is often a barrier. So we're having really real conversations about that. And what are those moments of joy that may already be in our lives that we can more mindfully attend to? And again, hearing testimonials of that, hearing how other people are doing that. And then what are those barriers that we have to navigate in order to, we deserve to have joy, right? We deserve to have those experiences. How can we really build a more supportive community that really uplifts that? Next slide, please. And we are continuing to offer our dialectical behavior therapy for moms to be group at Grady as well. And again, I mentioned earlier how one of the things we're thinking about is how to really increase access. And so making sure that we're integrating more into the systems where women are accessing care. So we're locating this in the OB/GYN clinic. Right now, we're offering it virtually and really trying to, again, address the same things I've been talking about. So thinking about how to manage stress and really provide tools and resources to regulate emotions. And so a lot of the skills that I've already talked about are incorporated in this group and are actually pulled from this. And one of the things that's really important, and we've been doing this for a while, actually started doing it with parents. And so working at that 2 to 5 year age where there's a lot of parenting stress because you're managing a lot with your kids and your own life. And what we learned from the moms we were working with in that project is, I wish I had had this in pregnancy. Like this would have been really helpful to me at that time. And so that's what we did. And so we've moved it now. We're still offering it for parents, but also really looking at it during pregnancy. And how do you really talk about these skills in relation to chronic stress? So in relation to all those things, again, that were listed that women are having to contend with. Next slide, please. And so this is just an outline of the group. And I know we're probably tight on time, so I won't go in depth, but I just want to highlight one of the things that I think is so powerful about this group. It's a skills group. So we kind of present these as tools or resources that you can use. And what happens is the participants talk about how they're using it in their daily life, what they struggled with, what went well, and giving really those real world examples so that it translates outside of the therapy group, right? Because it's great to have the therapy space to really process and be able to go deep with those skills, emotions, and experiences. But what we really want is for this to change a person's day-to-day life and be able to be a resource for them. And so it's so powerful in the group, just the things that are shared in the group and the way that the women help each other and really problem solve some of the things that they're dealing with is a really powerful process. And as you can see, we kind of cover a lot of the skills I've talked about, and I'm happy to share more if there's questions about that. Next slide, please. And just we're in the process of collecting data on this group. And one of the things that's really exciting working with Abby that we're able to do is learn from each group and then make tweaks as we need it. So I think as we've been talking about, I guess the theme I would say is really listen to Black women, learn from them, and incorporate that into what we're doing is so important. And we're able to really, each group, see what they learned in group, what went well, what didn't, and then incorporate that into the next one. So here are just a few of the things that have been shared. Being pregnant, you have to be mindful that a lot of your mental and physical connections are vital to each other. You have to be willing to talk about your emotions and be able to rectify them or let them go. So I think participants are finding this, again, to be a safe space where they can really process some of the things that we often just don't get time in our day-to-day to be able to really work through. And then the second quote, learning how to be in the moment with my relationships and people day-to-day, learning how to express what I feel and move through it. So again, really creating the space and the support network, right? Because in a group or working with someone, you have someone that can really affirm and validate this process of being able to process through things so you can move through it. And then also being able to be more present in your day-to-day and those things that bring you joy and those things that are positive, those relationships and people. Because so often we have to focus on the threat or the challenge or the stressor, right? And so we sometimes don't get to be as present with the things that bring us joy. So this being a place where we can promote more of that. Next slide, please. So these are just some references for those that want to kind of go deeper. So I know I was told maybe people can take a picture, so we'll leave it up for just a second, but really happy to share any more information. Abby and I think our contact information is next, so you can definitely reach out to us. Like I said, we're constantly learning this, so would also love to hear from other folks what they're doing, how it's going, and how we can build more of this network of support that really centers the strengths and assets of Black pregnant women. And so here's our contact information. And I think we're open for Q&A. Okay, so do you see these two, Abby? I know. So when will dbtmtv be ending?
Great question. Not anytime soon. We hope to be offering it as long as possible. We continue to look for opportunities to get additional support to kind of keep it going and grow it. It's very easy for if you're interested in it yourself, or if you want to refer anybody to it, you can go to our, you can just go to www.refertogtp.com and put in your information, and that information is there. That same information is also on our Grady Trauma Project website at www.gradytraumaproject.com. And feel free to contact us about the. Thanks, Caroline. And let's see. Yes, so no, these patients, it's not only available to Grady patients. We have it wide open for anybody in the community of Atlanta, especially now that it's virtual. We can really reach even more folks, and we always have space available. So please utilize this service. It's something we want to get to folks as much as possible.
And then one other thing I just want to highlight that we're starting to is offering trainings in the community on some of these skills. So we just had a training last week that was wonderful, working with family support coaches who, again, those that are interacting with Black pregnant women regularly. So wanting to provide supports out in the community as well, because not everyone's going to do a group, right? And we recognize that, but we want to be able to make sure that we have kind of those multiple resources available. Oh, and I see the emotions wheel, just so for Jody, if you Google it, you actually can Google it, and there's lots of different images that you can pick, but that one, just Google emotion wheel and it will pop up in the images tab.
Any other questions? Great. Well, thank you so much. It was really an honor to be here and talk to you today, and look forward to hearing the rest of the summit conversations.
Yeah, thank you, everyone.